just have a seat right here. Good. How are you doing today? Oh, great. Okay, so I'm going to be your physician today, and my name is Annie. And before I get started, I just wanted to go over one thing. As previously mentioned, the initial consultation today is included in any of our treatment plans. So if you decide to go ahead with any of the treatments, this consultation is free of charge. However, if you decide against it, you will be billed a total of $50 for the appointment today, okay? Good. So basically what I'm going to do first of all is I'm just going to go over some questions with you. I want to get a good look at your current health and your past history, and then I will take a look at your hair, the hairline, and with all of the information combined, I will be able to let you know whether or not one of our treatments are suitable for you, and I can offer up some options, okay? Good. All right, let's begin. Just to confirm, I need your first and last name. Okay, good. And do you currently have any allergies that you're aware of? Okay. Your approximate height? All right. And your approximate weight? Perfect. Now, do you have a personal history of lung disease? Heart disease? Cancer? Diabetes? Okay. Any abnormal bleeding or any conditions that would cause abnormal bleeding? Good. Have you had any surgeries in the past? Okay. And how old were you? And how did you respond to the anesthetic? Okay. So no issues. Great. Have you had any blood transfusions in the past? Okay. And are there any religious or cultural practices that would stop you from getting a blood transfusion if you ever needed one? All right, good. Are you taking any medications? And I need to know about supplements as well. Daily vitamin? Okay. Have you had any recent changes in your overall health? This would be in the last 3 to 6 months, I would say. And as far as your skin and hair routine goes, could you please just let me know what you're doing currently? Do you moisturize? What is it that you're using? Your hair routine? Okay, well, let's just start with skin. So do you moisturize? No. All right. How often are you bathing? And your hair routine, how often are you shampooing your hair? And conditioner? No? Do you use styling products? Okay. Good. The reason we ask that is because you typically don't want to wash your hair any more than 3 times a week. It's actually quite unhealthy. So that's one thing that I would recommend changing from here on out. Any more than 3 times a week, then you risk damaging even more of the follicles, and it causes them to behave abnormally. So because you're stripping away all of the essential oils, what happens is your scalp will attempt to make up for it, and then you'll be producing even more oils, which is sometimes not such a good thing. Yeah. Okay. And are you a smoker? Do you drink alcohol? How frequently? Okay. And do you drink caffeine? Soda is included. Okay. And how frequently? Daily. All right. Do you use any recreational drugs? Okay. Are you currently experiencing any discomfort within the scalp area? All right. And how many hours of sleep are you typically getting? Okay. No, that's much better than most people. Sleep is essential. Are you currently active? Do you partake in any exercise? Okay. On a daily basis, are you exposed to any environmental or occupational hazards? So, for example, any chemicals that you're working with, any toxins? None. All right. Okay. Now, if you don't mind, I'll just put my notepad aside here. I'm just going to assess your scalp. I'll just be putting these gloves on, okay? Yes, it's quite warm in here, so you'll have to excuse me. This might take a second. Yes, well, it's nice to have warm weather finally, I must say. It's just our AC needs to be replaced, and I've been a bit slack on getting it done, so yes, okay. So if you don't mind, I'm just going to be touching you quite closely. Okay, just a moment here. Take a look at your scalp. Alright. This isn't going to hurt, it's just going to feel a little bit tingly maybe. I'm just taking a look at the follicles themselves. Okay. Good. Alright. So let me just write this down in your chart. Well, I mean, the good news is that you most certainly do there are definitely some options that I can offer you that I'm quite confident will work for your hair loss, and I think you'll be quite satisfied with the result. So what I'm noticing is that the temporal parts of your skull, so just right here, is obviously where you're starting with the hair loss, and then you're kind of experiencing some thinning in the frontal area. Based on the pattern that I see, I'm classing you as a type 3 hair loss, and that just means in the temporal areas and then starting to thin in the frontal. But the good news is that there are some things that we can offer you, and while surgical treatments do work very well, they're quite invasive, and I don't think we need to get that far at this point. So what I would suggest is a prescription for finasteride, and what that does is it's 1 milligram that you take daily in a pill form. And basically what happens with hair loss is that you have DHT throughout your system, and that is an essential steroid for several different bodily functions. So it's not something that we want to be rid of. It's quite important. But with hair loss, you get an excess amount of DHT going into the follicle, and it causes permanent damage and also death of the follicle, which is very difficult to treat when it's progressed. Not quite as far as yours. Yours looks quite treatable, actually, which is great. But there are a lot of people that come in. I have clients that come in and they just kind of procrastinate, and they finally think, I need to do something. And at that point, surgery is their best option, but I'm glad you decided to come before it got to that point. So yes, I'm sorry I got ahead of myself here. Yes, so the DHT that's going to your hair follicle is causing damage, and what the finasteride does is it blocks the DHT from entering the follicle, so that while you're taking it, it can sometimes reverse some of the damage done, but for the most part it prevents future damage. Well, the success rate is quite good, but there are some instances where it doesn't work, and it's the same with every prescription that you would get. So for some individuals it works really well, and for some it doesn't work quite as well. So I would just suggest that we start you with a 3-month supply, and I can write you a prescription right now. Then in the meantime, what I would do is begin with the scalp treatments. So I would suggest that you come in once a week for the treatment, and it's just called minoxidil, and what it is a medicated cream that I'm putting on. So first what I do is I spray your hair with our special treatment that we offer here. It's just a lot of essential oils and botanicals and herbs, and I know a lot of people are completely against the natural health craze, but we highly recommend it because we have seen great results. So first I would just put that on the areas where you're experiencing hair loss, and then I would put the medicated treatment on top, and we just kind of massage it in and let it sit, and then you're able to go ahead and use our facilities to just make sure that you look okay before you leave. We don't want you to take it off. You can shower in the evening to remove any of the excess treatment, but you will want to walk to your car with that on. Okay. So, given the information that I've just presented you with, would you like to go ahead with the prescription and the treatments? Okay, great. So what I'm going to do first is I'm going to write you the prescription. And you can just tuck that away, and then we can begin the first treatment today if you'd like. Good, all right. Now, this is not covered by a medical plan, but I assure you that the cost will definitely be worth the benefits, okay? All right, there you go. Good. Okay, so let's get started. Let me go ahead and put these gloves back on. Well, gloves on. You know what I meant. Oh, here we go again. Just excuse me. That's one thing that always tends to happen when I am working during the warmer months. I have clammy hands. Now my colleague keeps telling me that I should get the Botox treatment. Oh, you've not heard of it. Botox can be used to treat excessive sweating, and for those who don't like perspiration on their hands, they actually can inject it into the palms, and that alleviates the sweating. I don't really like to do anything invasive. It's not harming anybody, so. Alright, so I'm just going to, sorry. I'm just going to gently shake the botanicals. Well, it seems to make suds when you shake vigorously, so I just like to rock it gently back and forth. Alright, so I'm just going to spray this on your scalp, and then I will massage it into your hair. Alright, excuse me, I am going to be getting up close again here. Well, the key is to saturate the hair, which primes it for the medicated treatment. So here we go. Okay, almost done. Good, good. Alright, so next we have the medicated treatment here. Yes, this is in fact available in a prescription, but this is also not covered by any of your medical plans available, and because we can buy it in large quantities, we are actually able to offer it at a much lower cost to you, even within the consultation and appointments. If you did it at home, it would be much more expensive, so a little treat for you. smells quite lovely, actually. Alright. So let me just go ahead and apply this on your scalp here. Yes, so it does give an oily appearance to your hair and your scalp. There we go. So let me just remove these gloves. Oh, you brought a ball cap. That's fantastic. I hope it's not one that is too near and dear to your heart, because you will likely get some of the medicated treatment on. But you could always use it for future appointments as well. Just keep this one as your treatment cap, and then that gives you an excuse to go out and purchase a new one, right? Oh, sorry. You have a large collection, I understand. No. Okay, so that's it for today, and if you would just like to go back to the front desk, she'll show you to the bathroom, and you can just make sure that you look presentable to go out. Okay. Thank you so much for choosing us, and I hope to see you soon. Yes, you can make an appointment at the front desk as well. Yes, I will be taking care of all of your appointments from here on out.